think what's important, as you were saying, in 2018 at least, the AEA and the AUA put symptoms of testosterone deficiency as part of their diagnostic criteria.
Correct.
Whereas before it was a number.
Correct.
If you didn't have a low number, they said your symptoms didn't matter.
That's correct.
So 2018, we've been doing this for 12 years.
Yeah.
We've been doing this differently, but at least you have those guidelines.
That's correct.
And if I can go really quick over symptoms, and to me, symptoms of testosterone deficiency or low T vary considerably. They can be very non-specific. And there's a window, a spectrum.
Right.
So we see in our clinic a lot of patients who are the lower end of the spectrum. They are fat, depressed, ED, no energy. But we also see the patient that are the upper end of the spectrum. This is usually the executive, the ex-athlete, who, you know what, he used to be 80 or 90%. He's used to be at his best. And then now he doesn't perform as well. He's starting to have brain fog. He's starting to, his work function declines. So we're not just saying that the patient with low T is the 20% one. That's a whole spectrum.
Right.
And we need to respect patient. I think this is where the art of medicine is coming back, where we need to really elicit the right symptomatology to really be like, okay, you're not feeling well.
Right.
I understand you, I believe you. Whereas before it used to be, you're not feeling well, your level is not less than 300, nothing is wrong with you, it's in your head.
Right.